All right, if you're on your way to becoming a CNA, this one is for you. Today, we're diving deep into cancer care, which is a really central part of the work you'll be doing. We're going to cover the essential knowledge you need to give that compassionate, effective care your patients deserve. Let's get right into it.
I really want to start with this quote because it just hits the nail on the head. It perfectly captures what your role is all about. It's not just about ticking off tasks on a list, it's about human connection. You are often the person spending the most time with a patient, and your presence, your attention, your empathy, honestly, it matters more than you can probably imagine.
Okay, so to be that source of comfort and that crucial set of eyes, we first need to get a handle on the challenge our patients are up against. So we're going to start with the basics of the disease itself.
So what even is cancer? Well, the word itself actually comes from the Greek word karkinos, which means crab. And when you think about it, it's a really powerful image, right? The disease was seen as the central body with these legs or arms reaching out and invading all the tissue around it, just like a crab. And that central body, that's what we call a tumor. So let's break that down. A neoplasm, that's the technical term for what we all call a tumor. See, our bodies have these amazing built-in rules to keep cell growth in check. A tumor starts when a group of cells basically goes rogue. They just stop listening to those signals and start growing completely out of control.
But here's a super important point. Not all tumors are cancer. You've got to know the difference. Benign tumors are non-cancerous. Yeah, they grow, but they stay put. They're contained and don't invade other tissues. Malignant tumors, that's what we're talking about when we say cancer. These are the aggressive ones. They divide like crazy and they invade nearby healthy tissue.
And this right here is what makes malignant tumors so dangerous. It's a process called metastasis. This is how cancer spreads. First, those malignant cells break away from the original tumor. Then, they hop onto the body's highway systems, the bloodstream or the lymph system. They travel to a totally different part of the body, get off at an exit, and start a new tumor. Understanding this is absolutely critical.
So, knowing how cancer can spread leads us directly to one of your most vital jobs, observation. Because you spend so much time with patients, you are the frontline defense. You're in this unique position to spot little changes that could be huge warning signs.
And here is an incredibly useful tool to keep in your back pocket. It's the CAUTIONS acronym. This covers the big, general warning signs of cancer. Memorizing this can seriously help you organize your thoughts and observations. If you notice a patient has a cough that just won't quit, or they mention that it's getting harder to swallow, those are things you need to report right away.
And here's another fantastic tool. This one is specifically for skin cancer. The ABCD rule for melanoma is something you can literally use every single time you're helping a patient with bathing or skincare. You just ask yourself, is a mole asymmetrical? Does it have a weird irregular border? Is the color all splotchy? Is it bigger than a pencil eraser? And has it been changing over time? Your eyes are one of the most powerful tools we have.
And this is the whole point. Why do we stress observation so much? Because a person's absolute best shot at survival is early detection. Period. When you notice something from that cautions list or the ABCD rule and you report it, you're not just doing a task. You could literally be saving someone's life.
Okay, so what happens after someone is diagnosed? Let's talk about the common treatments. Understanding these, and especially their side effects, is the key to knowing what your patient is going through and how you can best help them.
The first big one is surgery. And the goal here is pretty straightforward. Physically cut the cancer out of the body. It can be an invasive approach, but it's often a very effective way to get rid of a tumor that hasn't spread. But surgery has a huge impact that you're going to help manage. Of course, there's post-op pain, but you also have to think about the deep emotional and physical adjustment to a changed appearance, like after losing a breast, or learning to live with something new like an ostomy. And, for sure, their mobility is probably going to be limited, and they'll need your help. Next up, we have chemotherapy. Now, this is what we call a systemic treatment, which means it affects the entire body. It uses these really powerful drugs that are designed to hunt down and kill cells that divide rapidly, which, as we know, is exactly what cancer cells do.
But here's the catch. Cancer cells aren't the only rapidly dividing cells in our body. Think about it. So are hair follicles, the cells lining our mouth and gut, our immune cells, and that's exactly why chemo has such tough, widespread side effects. You'll be helping patients deal with everything from hair loss and crushing fatigue to really painful mouth sores and a super high risk of infection.
The third major treatment is radiation therapy. Now, unlike chemo, this is usually a localized treatment. It uses high-energy beams, kind of like super-powered X-rays, to zero in on and destroy cancer cells in one specific area. Sometimes they even implant tiny radioactive seeds right inside a tumor.
For you, as a CNA, the number one thing you'll be managing with radiation is skin care. The area being treated can get really red, irritated, and sensitive, almost like a bad sunburn. Fatigue is also a really big deal. And hey, if your patient has those radioactive implants, you're going to need to follow some very strict safety rules to limit your own exposure. So all of this brings us to the real heart of the matter. We've talked about the disease, we've talked about the treatments. Now let's zoom in on what you do. How do you take all this knowledge and turn it into amazing physical and emotional support?
Let's get really practical here. When you walk into your patient's room, what is your role? What are the key things you need to be focusing on to make a genuine difference in their day-to-day life?
Physically, your role is huge. Pain control is number one. Always. Always report any sign of pain. You also have to be a detective for the side effects of pain meds, like constipation. You'll be providing super careful skin and mouth care to prevent sores. You'll be assisting with daily activities when that fatigue is just too much. And you will become an absolute expert at infection control because your patient's immune system might be really weak.
And then there's the emotional support, which is every single bit as important. Sometimes the most powerful thing you can do is just sit and listen. Just be there. Notice if a patient who's normally chatty is suddenly quiet and withdrawn, and report that. Your calm presence can bring down so much anxiety. And always respect their dignity and their feelings. Create that safe space where they feel okay sharing what they're afraid of and what they need.
So, we'll end this by coming full circle, right back to that idea we started with. The tasks are important, don't get me wrong, but that's the baseline. The real question for you to carry with you throughout your career is this: how will you be more than a caregiver? How will you be that source of comfort, of observation, and of humanity that your patients need so desperately? That right there is the art of this job.